Have you ever walked into a doctor's office, hoping for answers, only to be dismissed with a question that made you feel small, ignored, or stereotyped because of your age? If you're a woman over 60, you might have faced this more often than you deserve. Questions that undermine your health, your independence, and your dignity. In this video, we're exposing the 6 dangerous questions doctors might ask that could signal they're not taking you seriously, or worse, putting your health at risk. From dismissive remarks about just your age to intrusive assumptions about your personal life, these red flags can have serious consequences if ignored. You need to watch until the end because knowing these questions could empower you to demand the care you deserve, protect your well-being, and ensure you're treated as a person, not a number. Before we begin, I would appreciate it if you like this video. You can help me continue to spread the old age lesson. If you haven't subscribed yet, I recommend you subscribe and turn on the bell so you don't miss any videos. If you like this video, please comment number 1. If you don't like it, comment number 0 to let me know, so I can make a better video for you. Now let's get started. 1. Are you sure it's not just your age? The question, "Are you sure it's not just your age?" is one of the most infuriating, dismissive, and dehumanizing phrases an older woman can hear in a medical setting. It's a phrase that's thrown around far too often, echoing through doctors' offices and clinics every single day. Imagine this. You muster the courage to visit a healthcare provider because something feels off. Perhaps your joints ache in a way that's unfamiliar, more persistent than the occasional stiffness you've experienced before. Maybe your heart races unpredictably, leaving you breathless and anxious, or your memory falters in ways that make daily tasks feel like climbing a mountain. You sit in that sterile exam room, vulnerable yet hopeful, carefully articulating your symptoms, expecting a thoughtful response, a plan, or at the very least, a genuine inquiry. Instead, the doctor, often with a cursory glance at your chart, leans back in their chair, offers a patronizing smile, and says, "Are you sure it's not just your age?" In that moment, your concerns are swept aside, your symptoms reduced to an inevitable byproduct of growing older. The subtext of this question is devastating. "I'm not going to take this seriously. Your symptoms don't warrant my effort. I've already decided the cause based solely on the number next to your name." This isn't medicine. It's ageism cloaked in a white coat, a lazy shortcut that undermines trust and, in some cases, endangers lives. Let me share a story that illustrates the real-world consequences of this dismissal. I once worked with a patient in her late 60s, a vibrant woman named Ellen, who came to me after a frustrating experience with her primary care physician. She had been experiencing chest discomfort and nausea for weeks, symptoms that were vague but persistent enough to alarm her. She described them meticulously to her doctor, hoping for answers. His response? A shrug and the suggestion that it was likely just indigestion or part of aging. No EKG, no blood work, no referral to a cardiologist, just a prescription for antacids and a pat on the back. 2 days later, Ellen suffered a minor heart attack. She was lucky to survive, but the damage to her trust in the medical system was profound. That doctor's flippant dismissal could have cost her life. This isn't an isolated case. The phrase, "just your age," is a dangerous catch-all, used to brush off symptoms that could point to serious, treatable conditions. I've seen it used to ignore thyroid disorders that cause debilitating fatigue, early signs of dementia that could benefit from early intervention, autoimmune diseases that require careful management, and even cancers that, when caught early, have far better outcomes. A 72-year-old patient of mine, Margaret, was told her chronic fatigue and weight gain were normal for her age. It took months of advocacy and switching doctors before she was diagnosed with hypothyroidism, a condition that was easily treatable with medication. Another woman, in her early 60s, was told her joint pain was just aging only to later discover she had rheumatoid arthritis, which could have been managed earlier to prevent joint damage. When a doctor attributes every symptom to aging, they erase your individuality. They dismiss your unique medical history, your genetics, your lifestyle, and the specific nuances of your symptoms. Aging does bring changes, stiffer joints, slower recovery times, shifts in energy, but that doesn't mean every new symptom is inevitable or untreatable. Pain is still pain. Fatigue is still fatigue. A sudden change in cognition, heart rhythm, or digestion is always worth investigating. The assumption that aging explains everything is not only lazy but also rooted in a harmful stereotype that older women, in particular, are prone to complaining, or exaggerating their symptoms. This bias is compounded by gender, as women are historically less likely to have their symptoms taken seriously compared to men. If you hear this question, "Are you sure it's not just your age?" and it's followed by no further questions, no tests, no thoughtful discussion about your symptoms, that's a red flag. A good doctor listens, asks detailed questions, and considers a range of possibilities. They order blood work, imaging, or referrals when appropriate. They treat you as a person, not a walking stereotype. If your doctor dismisses you, you owe it to yourself to advocate for your health. Request specific tests, seek a second opinion, or find a new provider who respects your concerns. Your body, your health, and your quality of life deserve nothing less. 2. Do you want to do all these tests at your age? The second question, do you want to do all these tests at your age? Is equally insidious, often cloaked in a veneer of concern but carrying a deeply troubling implication, that your age somehow makes you less worthy of thorough medical care. Picture this scenario. You've been grappling with troubling symptoms. Perhaps shortness of breath that makes climbing stairs feel like a marathon, abdominal pain that wakes you at night, or confusion that's starting to interfere with your daily life. You've finally worked up the energy to make an appointment, sit through the waiting room, and explain your concerns to your doctor. They nod, list the necessary diagnostic steps, blood work, a CT scan, perhaps a specialist referral. You feel a glimmer of hope that answers are within reach. Then, the conversation takes a turn. The doctor pauses, their tone shifting to one of hesitation or feigned compassion, and they ask, "Do you want to do all these tests at your age?" The implication is clear. Pursuing answers is somehow excessive, burdensome, or even selfish. It suggests that at a certain age, whether you're 70, 80, or beyond, you should quietly accept discomfort, decline, or uncertainty without pushing for clarity. This question isn't just dismissive. It's reckless, undermining your right to quality care and perpetuating the dangerous notion that older patients are less deserving of resources, time, or effort. Let me tell you about Ruth, a 76-year-old patient of mine who experienced this firsthand. Ruth had been noticing mood swings, difficulty concentrating, and a foggy feeling that made her worry she was developing dementia. Her primary care physician initially chalked it up to normal aging and suggested she learn to live with it. When Ruth, a fiercely independent woman, pushed for further evaluation, her doctor responded with, "Do you want to go through all those tests? They're expensive, and at your age, is it worth it?" Frustrated but determined, Ruth sought a second opinion from me. We ordered a comprehensive blood panel and a urinalysis. The results? A severe vitamin B12 deficiency and a urinary tract infection, both treatable conditions that can mimic dementia in older adults. Within weeks of treatment, Ruth's clarity and energy began to return. She didn't need to suffer. She just needed a doctor who saw her as more than her age. This pattern is all too common. I've seen patients dismissed when seeking answers for symptoms like chronic pain, digestive issues, or fatigue, with doctors suggesting that tests are too much for someone at their stage of life. This mindset is not only insulting but also medically irresponsible. For example, a 68-year-old woman named Linda was told her persistent abdominal pain was likely just aging, and that invasive tests like a colonoscopy weren't necessary. She insisted on the procedure and was diagnosed with early-stage colon cancer, which was treatable because it was caught in time. Had she listened to her doctor's dismissive advice, the outcome could have been far worse. The decision to forego testing should never be based solely on age. If a doctor suggests skipping diagnostics, they must provide a clear, evidence-based rationale, perhaps a specific risk associated with the test or a well-reasoned explanation tied to your overall health. But if their reasoning boils down to "you're too old," that's a sign of bias, not expertise. Age does not diminish your right to the same standard of care you would have received at 40 or 50. Symptoms like pain, shortness of breath, or cognitive changes are not inevitable parts of aging. They're signals that something may be wrong, and they deserve investigation. Moreover, this question often carries an unspoken economic judgment, implying that tests are a waste of resources for older patients. This is particularly harmful for women, who already face systemic biases in healthcare. Studies have shown that older women are less likely to receive aggressive diagnostic workups or treatments compared to men of the same age, even when presenting with similar symptoms. This disparity can lead to delayed diagnoses and worse outcomes. Your health is not a cost-benefit analysis. You deserve a doctor who prioritizes your well-being over outdated assumptions or financial considerations. If you encounter this question, don't let it derail your pursuit of answers. Ask your doctor to explain why they're hesitant to order tests. Request a detailed discussion of the risks, benefits, and alternatives. If their response feels dismissive or rooted in age alone, it's time to seek a second opinion. You have the right to a provider who treats you with respect, listens to your concerns, and pursues answers with the same diligence they would offer any patient. Your symptoms matter. Your health matters. Don't let anyone convince you otherwise. If you are still watching this video and finding these lessons useful, please comment number 1 below to let me know that you are still watching this video with me. Thank you for your valuable time. 3. Are you still sexually active? One of the most awkward, frequently misused, and often inappropriate questions posed to senior women in medical settings is, are you still sexually active? On its face, this question can have legitimate medical relevance. Sexual health is an integral part of overall well-being, and for women experiencing specific symptoms, such as urinary incontinence, pelvic pain, vaginal dryness, or hormonal imbalances, discussing sexual activity can provide critical insights. For instance, a doctor might need to assess whether sexual activity is contributing to recurrent urinary tract infections or if menopausal changes are affecting intimacy, which could guide treatment options like hormone therapy or pelvic floor exercises. When asked with clear clinical intent, sensitivity, and respect, this question can open a productive dialogue about a woman's health needs. However, the reality for many senior women is far less thoughtful. Too often, this question is tossed out casually, without context, preparation, or even a basic acknowledgement of the patient's comfort level. Worse, it's frequently delivered with a tone that carries judgment, surprise, or even amusement, as if the notion of a woman in her 60s, 70s, or 80s maintaining an active sex life is somehow unexpected or outlandish. The word "still" in the question is particularly loaded. It implies that sexual activity has an expiration date, as if menopause or a certain age automatically erases a woman's desire, capacity, or right to intimacy. This assumption is not only outdated but also deeply harmful, as it risks alienating women from discussing their health openly. I've heard countless stories from older women who faced this question in ways that left them feeling diminished. One patient, a vibrant 74-year-old who came in for routine blood pressure management, recounted how her doctor abruptly asked, "Are you still sexually active?" with a raised eyebrow and a smirk, as if the idea was inherently comical. She was there to discuss her hypertension, not her personal life, and the question felt like an invasion of privacy rather than a medical necessity. Another woman, 82 years old, confident and proud of her fulfilling relationship, shared a particularly poignant experience. During a visit for a minor back issue, her doctor asked the question in a tone that she described as, "like I was a naughty teenager caught sneaking out." Humiliated, she lied and said she was no longer sexually active, not because she was ashamed of her relationship, but because the doctor's approach made her feel judged and exposed. These experiences have real consequences. When a question about sexual health is asked insensitively, women often shut down. They may avoid discussing genuine concerns, such as discomfort during intimacy, hormonal changes, or even sexual dysfunction, because the interaction has left them feeling embarrassed, trivialized, or as though their bodies are no longer worthy of serious consideration. This is particularly damaging for senior women, who already face societal stereotypes that dismiss their vitality and autonomy. A poorly framed question can erode trust in the medical system, discouraging women from seeking care for issues that could be addressed with proper support, such as lubricants for vaginal dryness, pelvic floor therapy, or counseling for intimacy concerns. The truth is that sexual health remains relevant at any age, and senior women deserve to have their needs addressed with the same respect and professionalism as any other patient. If a doctor believes this question is medically necessary, they must provide context, explaining, for example, how it relates to the patient's symptoms or treatment plan. For instance, a doctor might say, "I'd like to ask about your sexual health because it can help us understand your urinary symptoms better. Is that okay with you?" This approach respects the patient's autonomy and sets a collaborative tone. If the question has no clear relevance to the visit, say, a woman is there for a sprained wrist or a flu shot, it should not be asked at all. And under no circumstances should it be delivered with condescension, surprise, or a tone that implies a woman's sexuality is somehow an anomaly. If you're a senior woman and a doctor asks this question in a way that feels off, whether it's the tone, the lack of explanation, or an air of judgment. You don't owe them your candor or your time. You have the right to redirect the conversation, ask why the question is relevant, or, if necessary, seek a provider who treats you with the dignity you deserve. Your body, your choices, and your health matter, no matter your age. For, are you still living alone? At first glance, the question, "Are you still living alone?" might seem benign, even caring, when asked by a doctor. After all, a physician's role includes assessing a patient's overall well-being, and living arrangements can sometimes provide insight into potential health risks. But for many senior women, this question lands with an undercurrent of judgment that feels anything but supportive. The word "still" carries an implicit assumption that living alone as an older woman is unusual, risky, or even reckless. Too often, the question is asked with a tone of suspicion, pity, or condescension, as if independence at a certain age is something to be questioned rather than celebrated. Many women over 65 are fiercely independent, thriving in their solo lifestyles not out of necessity but by choice. They manage their households, cook gourmet meals, drive to book clubs or volunteer gigs, lead community groups, hike with friends, or maintain active social lives. For these women, living alone is a source of pride and empowerment, a reflection of their autonomy and capability. Yet, when a doctor asks, "Are you still living alone?" with a furrowed brow or a tone that suggests concern before evidence, it can feel like their independence is being put on trial. The question often implies that living alone is inherently dangerous, as if a woman's age automatically makes her fragile or incapable of managing her own life. I recall a patient, a sharp and spirited 79-year-old who had lived alone for over 2 decades after her husband passed away. She handled her finances, meticulously organized her medications, and maintained a pristine home filled with her artwork. She visited the doctor for a minor foot injury from a hiking trip, expecting a straightforward evaluation. Instead, the appointment turned into an interrogation about her living situation. The doctor pressed her on how she managed grocery shopping, whether she had someone checking in on her, and if she was sure she was safe living alone. She left the appointment feeling infantilized, as though her injury, a simple sprain, had cast doubt on her entire way of life. "I went in for my foot," she told me, "but I walked out feeling like I needed to prove I wasn't helpless." This kind of interaction isn't just frustrating. It's a form of condescension disguised as concern. It assumes vulnerability without evidence and undermines the agency of women who have spent decades proving their resilience. For many senior women, living alone is not a problem to be solved but a deliberate choice that reflects their values and strength. Studies consistently show that older adults who live independently often report high levels of life satisfaction, particularly when they have strong social networks and access to resources. Yet, the stereotype of the frail elderly woman persists, coloring medical interactions with unwarranted assumptions. Of course, there are situations where asking about living arrangements is medically relevant. If a doctor observes signs of cognitive decline, frequent falls, or difficulty managing chronic conditions, it's reasonable to explore whether a patient's living situation supports their health. But even then, the question must be asked with respect and specificity, grounded in observable evidence rather than blanket assumptions about age. For example, a doctor might say, "I noticed you've had a couple of falls recently. Can you tell me about your home environment and whether you feel safe there?" This approach is collaborative, focused on the patient's actual circumstances, and avoids casting doubt on their independence. If the question is asked without clear medical justification, or worse, with a tone that implies pity or doubt, it's a red flag. Senior women should not have to defend their lifestyle choices in a medical setting. If you're thriving on your own, whether you're 65 or 95, that's a testament to your strength, not a cause for concern. If a doctor's question feels like a challenge to your autonomy, you have every right to redirect the conversation, ask for clarification, or seek a provider who sees you as capable first. Living alone doesn't mean living at risk, it means living life on your terms, and that's something to be celebrated, not scrutinized. If you are still watching this video and finding these lessons useful, please comment number 2 below to let me know that you are still watching this video with me. Thank you for your valuable time. 5. Do you want to talk to your daughter about this first? This question can hit like a punch to the gut, and it's not hard to see why. It's not just a casual inquiry. It subtly undermines your autonomy, casting doubt on your ability to make decisions about your health. Imagine this. You're sitting in a doctor's office, attentively listening to the details of your treatment options. perhaps a new medication, a surgical procedure, or a lifestyle change. You're asking thoughtful questions, weighing the risks and benefits, and feeling confident in your ability to navigate this moment. Then, out of nowhere, the doctor leans back and says, "Do you want to talk to your daughter about this first?" Take a moment to let that sink in. Would a doctor ask a 45-year-old man, in the prime of his career, if he needs to consult his adult child before deciding on a prescription or procedure? It's highly unlikely. Yet, for older women, this question seems to slip out far too often, as if age has somehow eroded their capacity for sound judgment. It's not just a question, it's a microaggression rooted in outdated stereotypes about aging women as fragile, indecisive, or dependent. I recall a patient, a 68-year-old woman named Margaret, who had recently lost her husband of 40 years. She was sharp, independent, and proactive about her health. She went to an orthopedic surgeon to discuss a knee replacement that could help her regain mobility and continue her active lifestyle. Gardening, walking her dog, and volunteering at her local community center. The surgeon explained the procedure thoroughly, and Margaret was ready to ask follow-up questions about recovery time and physical therapy. Before she could even respond, the surgeon said, "Would you like to bring your son in to help you decide?" Margaret was floored. She hadn't mentioned her son, nor had she indicated any need for assistance. "I wasn't asking for help," she told me later, her voice tinged with frustration. "I was asking for options so I could make an informed choice." This kind of interaction isn't just annoying, it's harmful. Questions like these plant seeds of self-doubt, making women question their competence. They reinforce a pervasive stereotype that older women are inherently less capable, more forgetful, or overly reliant on others. This is especially insidious because it can erode confidence over time, leading women to hesitate or defer decisions they're perfectly capable of making. Studies have shown that older women are less likely to be offered the full range of treatment options compared to men of the same age, and patronizing questions like this only exacerbate that disparity. Unless you've explicitly provided legal documentation, such as a power of attorney, stating that a family member is involved in your medical decisions, your doctor should be addressing you directly, with the respect and attention you deserve. You've spent decades making choices for yourself and likely for others, raising families, managing households, or navigating careers. Your ability to understand your health and make informed decisions doesn't vanish just because you've crossed a certain age threshold. If a doctor bypasses your authority or assumes you need someone else to help you decide, they're not just disrespecting you, they're failing at their job. Trustworthy healthcare providers engage you as an equal partner in your care, not as someone who needs a babysitter. If they can't do that, it's time to find a doctor who will. If you are still watching this video and finding these lessons useful, please comment number 3 below to let me know that you are still watching this video with me. Thank you for your valuable time. 6. Are you sure you want to keep taking that medication? At first glance, this question might seem like a well-meaning check-in. After all, good doctors should periodically review your medications, especially as you age and your body's needs evolve. Metabolism slows, kidney and liver function may decline, and certain drugs can interact in ways that weren't an issue when you were younger. A thoughtful discussion about your medication regimen is a cornerstone of responsible healthcare. But too often, this question, "Are you sure you want to keep taking that medication?" is delivered in a way that's less about collaboration and more about sowing doubt or exerting control. The problem lies in the execution. Instead of fostering an open dialogue, some doctors ask this question without providing context, alternatives, or a clear explanation of why they're raising the issue. It comes across as a vague warning, almost as if they're trying to nudge you away from a treatment without taking responsibility for guiding you through the decision. The subtext feels judgmental, as if you're being reckless or uninformed for continuing a medication that's been working for you. This is particularly frustrating when the medication in question is something you've relied on for years to maintain your quality of life. Consider the case of a patient I worked with, a 72-year-old woman named Susan. After her husband passed away, Susan struggled with grief and anxiety, but a low-dose antidepressant had been a lifeline. It wasn't a cure-all, but it helped her stay engaged, attending book club, visiting her grandchildren, and even taking up painting. She'd been stable on this medication for nearly a decade, with regular check-ins from her primary care physician. Then, a new doctor joined the practice. During a routine visit, he glanced at her chart and said, "We don't usually like older patients staying on antidepressants long-term." Are you sure you want to keep taking it? There was no discussion about her mental health history, no inquiry into how the medication was affecting her day-to-day life, and no suggestion of alternatives like therapy or a different dosage. Just a vague, ominous question that left Susan feeling judged and uncertain. Against her better judgment, she decided to try tapering off the medication, hoping to prove she didn't need it. Within a month, she was struggling. Her anxiety returned, she withdrew from social activities, and her daughter noticed her crying during phone calls. It took months to stabilize her again, all because a doctor's poorly framed question disrupted a treatment plan that had been working. This isn't how medication management should work. A responsible doctor doesn't just raise doubts, they provide data. They should review your health history, discuss how the medication is performing, and explore whether it's still the best option. If there's a concern, say, potential side effects or new research about long-term use, they should explain it clearly and offer a plan, whether that's adjusting the dose, switching to a different drug, or incorporating non-pharmacological approaches like counseling or lifestyle changes. Without that context, the question, "Are you sure you want to keep taking that?" feels like a scare tactic, not a partnership. This issue is particularly acute for older women, who often face assumptions that they're over-medicated or overly reliant on prescriptions. Data from the CDC shows that women over 65 are more likely to be prescribed psychotropic medications like antidepressants or anti-anxiety drugs than men of the same age, yet they're also more likely to have those prescriptions questioned without clear justification. The result is a double standard. Women are simultaneously overprescribed and undertreated, caught in a cycle of skepticism about their medical needs. You deserve better. If a doctor questions your medication, they should back it up with evidence and engage you in a real conversation, not leave you second-guessing a treatment that's been effective. You have the right to know why a change is being suggested, what the alternatives are, and how any transition will be managed to protect your health and well-being. Anything less is a disservice. Ladies, we've reached the end of this eye-opening video, and I hope it's left you feeling empowered, informed, and ready to take charge of your health. We've delved into the 6 dangerous questions doctors might ask that could dismiss your concerns, undermine your independence, or even jeopardize your well-being. Questions like, "Are you sure it's not just your age?" Or, "Do you want to do all these tests?" that too often brush off serious symptoms or make you feel like your voice doesn't matter. These are the red flags every woman over 60 needs to recognize to ensure she's treated with the respect and care you deserve. I want to hear from you. What have you learned today that has resonated with you the most? Maybe it's the confidence to walk out when a doctor dismisses your symptoms, or perhaps it's the realization that your independence and choices should never be questioned. Share one key takeaway you've learned from this video and how you plan to put it into practice in your life. Drop it in the comments below, because I'm reading every single one and I'm excited to see how this inspires you. If you found this video helpful, please leave your comment below, and don't forget to like, share, and subscribe to our YouTube channel for more real health advice tailored for strong, vibrant women like you. Your health matters, your voice matters, and together, we can keep advocating for the care we deserve. Stay empowered, and I'll see you in the next video.